We have begun our tests with the guidance of the Nigerian Center for Disease Control, NCDC, and we expect that it will be in full operations this week. We have also taken delivery of another PCR testing machine, which we are currently installing at the Edo Specialist Hospital in Benin. That testing machine and testing service should be ready within the next 2 weeks. With all the testing facilities we now have in Edo State, 3 of them, 1 in Iroa and 2 in Benin City, we will now have the capacity to perform a minimum of 1,000 tests daily in Edo State. With massive screening and testing, we will have sufficient information which is required to direct our decisions for proper management and control of this scourge. I'm also pleased to inform you that surveillance, contact tracing, and line listing, which is in Edo State, is very effective in all local governments. Every reported case is actively searched, and persons of interest, POIs, are thoroughly followed up on. We have started treating patients in 3 of the 4 isolation centers in Benin City, Iroa, and Auchi, where we have a total capacity of 300 beds and 30 ventilators. Our operations involve huge logistic efforts and coordination. We are coordinating over 500 people and training them to collect, process, and distribute samples, supplies, and palliatives. We have up to 2,000 men and women from the federal and state security agencies who are helping us to provide security for our health workers and residents while ensuring compliance and enforcement of our safety guidelines. Many of our people still do not believe that COVID-19 is real, and therefore are not internalizing social distancing, which is required to end this pandemic. We have therefore organized our communication team to rally our people by undertaking massive awareness and raise the consciousness of citizens to accept personal responsibility to protect themselves and our communities. We are utilizing all available media, from town criers, radio stations, billboards, and television stations to send our messages. As of today, Edo State has recorded 15 COVID-19 cases. Unfortunately, the worst may yet come, as we expect a rapid increase in the number of cases when we begin massive screening and testing. The good news is that with the steps we are putting in place, I want to assure all of you that we are fully prepared to combat this pandemic and emerge from it stronger and a more cohesive state. We will continue to impose a partial lockdown policy for now, but we will not totally shut down our economy because of the untold hardship which a total shutdown will cause to our citizens. However, we will review our decisions based on the evidence which we obtain from the mass screening and testing which we are undertaking. We realize, however, that there is need to do more social distancing at this time. Therefore, we are taking additional measures to ensure that people stay at home. Consequently, with effect from tomorrow, 20th of April, an order prohibiting the movement of people in Edo State from 7 p.m. to 6 a.m. will be in force. This order will be reviewed after 10 days when we have increased screening and testing of our citizens. The security agencies, by this directive, are mandated to enforce total compliance by ensuring that movement is restricted at night across the state. All drivers and passengers of vehicles bringing in essential workers and commodities into Edo State or passing through Edo State will be screened by health professionals and they will be triaged. We crave your indulgence to cooperate with them as we ensure that the process will go on without hitches. I also want to reiterate the ban on street trading, which was announced by the Deputy Governor, the Right Honorable Philip Schreiber, and to tell you that this is in the best interest of our people. This move is aimed at ensuring that all trading activities in this state during this period is concentrated in primary and secondary school premises, where we can strictly enforce social distancing. All drivers and passengers of vehicles bringing in essential workers and commodities into Edo State or passing through Edo State will be screened by health professionals and they will be triaged. Testing center at the University of Benin Teaching Hospital is now ready. We have begun our tests with the guidance of the Nigerian Center for Disease Control, NCDC, and we expect that it will be in full operations this week. We have also taken delivery of another PCR testing machine, which we are currently installing at the Edo Specialist Hospital in Benin.